this breaking news right now about the deal that was cut. First of all, let's zoom back in time to the campaign of 2008. Candidate Barack Obama, Senator Barack Obama, talking about how if any member of Congress, when they're putting together the legislation for health care, if any member of Congress is cutting a deal with the health industry, particularly the pharma, the drug industry, it should be public knowledge. Here he is in the Democratic debate, the CNN-sponsored debate of the Democratic primary candidates.
Negotiating behind closed doors, but bringing all parties together and broadcasting those negotiations on C-SPAN so that the American people can see what the choices are. Because part of what we have to do is enlist the American people in this process.
Okay, that's the first one. The second one is an interview with the San Francisco Chronicle, who put this video up on YouTube.
I'll put my plan forward, and I would welcome input and say, here are my goals: reduced costs, increased quality, coverage for everybody. If you have better ideas, please present them. But these negotiations will be on C-SPAN. And so the public will be part of the conversation and will see the choices that are being made. So if a member of Congress is carrying water for the drug companies and says, well, we can't negotiate for the cheapest available price on drugs because we need the money for R&D research, well, we'll have a discussion right there in front of the American people about the fact that the drug companies do need profits, but they're also spending a whole bunch of it on marketing television ads where nobody even knows what the drug is for. That builds in accountability into the system because now that congressman is put on the spot. And I would not underestimate the degree to which shame is a healthy emotion, and that you can shame Congress into doing the right thing if people know what's going on.
If people know what's going on. So, now, today, the headline, internal memo confirms big giveaways in White House deal with Big Pharma. In exchange for Big Pharma saying, we'll give you $80 billion over 10 years in reduced profits to Big Pharma. We'll give you an $80 billion discount over a 10-year period. The White House said, okay, according to this memo, that was provided to the Huffington Post by somebody who was intimately involved in the negotiations. They will agree to increase the Medicaid reimbursement rate to Big Pharma, agree to get these FOBs done, sell drugs to patients in the donut hole at 50% discounts. This totals $68 billion. In other words, there will be a discount there. That they will oppose importation of drugs. They will oppose rebates in Medicare Part D. The Obama administration will. The Democrats will. They will oppose repeal of non-interference and oppose opening Medicare Part B. What all this means is, and Greg Palast put it brilliantly, I'm sure you can find it over his website, gregpalast.com. I got the email from him last night. He sat down, if you go to hhs.gov, it's the Health and Human Services website, and right there on that website, they list all the expenditures of the federal government, Department of Health and Human Services, and they show how much money we're spending on drugs in the United States. It's just drugs. And over a 10-year period, it is $3.6 trillion. So pharma is going to get from the federal government $3.6 trillion. In order to protect their profits, they said, and frankly, the Obama administration, this is where the double bind comes in. The Obama administration says, okay, if you'll give us something, we'll give you something. And so Big Pharma says, okay, we'll give you a discount of $80 billion. Turns out $80 billion is 2%. In other words, Big Pharma said to in these closed-door negotiations, this was not broadcast on C-SPAN, Big Pharma said, we'll give you a 2% discount over the next 10 years. Now, Canada, according to here's a couple of examples. And again, from Greg Palast piece, gregpalast.com. The New England Journal of Medicine, 13 European nations, average discount that they're able to negotiate with these same pharmaceutical companies, by the way. Average discount they're able to negotiate, 35 to 50%. 35 to 55%. The Veterans Administration in the United States negotiates a 40% discount. This is mind-boggling. So here we have, we could be saving over the next 10 years. If this is $3.6 trillion and Canada, the European nations, the Veterans Administration are negotiating anywhere from 35 to 55% discounts. Let's just say it's 40%. Let's say it's 50%, because that's easy to do the math. What's half of $3.6 trillion? Well, half of $3 trillion is $1.5 trillion. So it'd be what, about $1.8 trillion, $1.7 trillion? That's $1,700 billion that we could have gotten if we simply negotiated with the drug companies, that instead we're going to give to them. Now, why would the administration do this? Because Big Pharma is going to spend $150 million on an ad campaign promoting this deal. Now, that's nothing in the world of Big Pharma. Keep in mind, they're going to make more than $1 trillion in profit from this deal. But $150 million spent on television advertising supporting this is more than John McCain spent in the entire presidential campaign. I mean, it's getting close to the little over $200 million that President Obama spent on television advertising in the entire campaign. So what we have here is an industry that is so rich and so powerful that they were able to cow the White House into this deal. That's the bottom line. They were able to cow them into it. And this is an industry, and here's the Big Pharma. You've also got the health insurance industry. Just mind-boggling numbers here. United Healthcare's CEO, Stephen J. Helmsley, remember his predecessor was Dollar Bill McGuire, the guy who ended up with $1.3 billion. Originally it was $1.78, but then he got busted for backdating stock options. His compensation is in 2007 was $13.2 million, and he's sitting on $744 million worth of stock options, and his ones from this year, $127 million. So this guy's getting over $127 million in compensation. That's one guy. Cigna's CEO, $120 million 5-year compensation package. And then you look at all of his stock options and whatnot. I mean, right across the board, we're talking about people who are multi-millionaires. And they're willing to let people die, frankly, to protect their profits. That, in my opinion, is sociopathic behavior. And that kind of sociopathic behavior is destroying this country. It is sucking the blood out of us. We're talking $1.5 trillion in our economy that could have gone to things like building factories, putting people to work, loans to entrepreneurs, small businesses, all kinds of stuff that instead is going to go to the CEOs and senior executives and stockholders of Big Pharma. Coming up next, the mad as hell doctor is here. Why is he mad and what's he going to do? Stay tuned. Thom Hartmann with you.